Stretch marks, night sweats, and a belly that feels like jelly. Welcome to the physical side of postpartum life. Think you know your body? Your postpartum self might surprise you. Welcome back to my Fourth Trimester Series. In the previous episodes, we've discussed the overall concept of the fourth trimester and the 5-5-5 rule for postpartum recovery. Today is episode 3, and I'm going to focus on the physical changes your body experiences after childbirth. And if you stick around to the end, I'll go through exactly when you need to get back in touch with your doctor for some further support. After giving birth, your body starts an incredible journey of healing and transformation. Whether you've had a vaginal delivery or C-section, your body has been through, well, literally a life-changing event and needs time to recover. The physical changes you'll experience can be divided into several categories: uterine changes, vaginal and perineal healing, abdominal changes, breast changes, and overall body adjustments. And I'm going to go through each of these one by one. First up, let's talk about uterine changes and vaginal bleeding. After birth, your uterus begins the process of returning to its pre-pregnancy size, which is called uterine involution. You'll experience contractions, often called after pains, as this happens. These can be particularly noticeable when breastfeeding, because when a baby suckles at your breast, your body produces oxytocin, which is the hormone that causes uterine contractions. Some women say this is even more uncomfortable than labour. Alongside this, you'll have vaginal bleeding, known as lochia or postpartum bleeding. This is completely normal and can last up to 6 weeks postpartum. The bleeding will be heavy at first, similar to a very heavy period, and gradually taper off. You'll need to monitor this bleeding and keep a rough eye on how much blood you're losing, but more about this later. If you had a vaginal birth, your vagina and perineum, the area between your vagina and anus, will need time to heal. This is especially true if you experienced tearing or had an episiotomy. You might feel sore, swollen, or experience discomfort for several weeks. Now let's talk about abdominal changes. Your belly won't immediately snap back to its pre-pregnancy state, and that's completely normal, despite what you might have seen with some celebrities. Your abdominal muscles have stretched significantly, and it takes time for them to regain their tone. Some women may experience Diastasis recti, which is a separation of the abdominal muscles that can occur during pregnancy. This separation can persist after birth, causing a visible bulge or pooch in your belly. I'll discuss this a bit more as well in the section on recovery strategies. If you've had a C-section, your recovery will involve healing from major abdominal surgery. You'll have an incision that needs careful attention and time to heal. It's normal to experience pain and discomfort around the incision site for several weeks. You may also feel numbness or pulling sensation in this area. I had a C-section myself with both of my babies, and I still have numbness around the incision site. Breast changes are, of course, another significant part of postpartum physical changes. Whether or not you choose to breastfeed, your breasts will go through changes, starting with producing colostrum and then engorging as your milk comes in around days 2 to 5 after birth. Engorgement is when your breasts feel full, heavy, and tender, or, as I like to say, like rocks. If you choose not to breastfeed, then your milk will gradually dry up over a few weeks. You can expect some other body-wide changes too. Night sweats as your body gets rid of excess fluid. Hair loss as the hormones that kept your hair from falling out during pregnancy level off. Skin changes, including the fading of the linea nigra, the dark line that may have appeared on your belly during pregnancy. Joint laxity, as your body still has relaxin hormone in its system. If you aren't breastfeeding, then relaxin can take up to 5 to 12 weeks to return to pre-pregnancy levels. And if you are breastfeeding, then expect it to take up to 12 months after stopping. Like many women, I noticed this increase in relaxin when I went to put my pre-pregnancy shoes on. My feet had grown a full size during pregnancy, and even a few years later, have stayed at that bigger size. Of course, every woman's postpartum journey is unique. Some may experience all of these changes, while others might only notice a few. So let's move on to how you can support your body's recovery process. Don't rush this time. Healing can take a while, so try to be patient. First and foremost, rest as much as possible. Your body needs this time to heal, and I know this isn't easy with a newborn. You'll have heard this hundreds of times, but try to sleep when your baby sleeps and be sure to accept help from family and friends when it's offered. Have another look at my video about the 555 rule postpartum, where I talk about how to do this a bit more. Using supportive garments can also aid in your recovery. You might find postpartum support belts or belly bands comforting, as they're designed specifically to support your abdomen and lower back. If you had a C-section, a postpartum support belt might help you feel more comfortable moving around, but check with your doctor first before wearing one. A good supportive bra can really help with breast discomfort, so it's worth investing in a proper maternity bra. Most women experience engorgement at some point, and your breasts can feel really heavy. Nutrition is also really important. Your body needs extra nutrients to heal, and if you're breastfeeding, to produce milk. Focus on eating a balanced diet rich in protein for tissue repair, iron-rich foods to replenish blood loss, calcium for bone health, fruits and vegetables for vitamins and fibre. I've done a whole video about postpartum weight loss where I talk about nutrition, so have a look for some more guidance about this. Try to stay hydrated too by drinking at least 8 to 10 glasses of water a day. If you're breastfeeding, hydration is especially important. Have a look at my free breastfeeding water intake calculator on my website if you want a better idea of how much you need to drink. I'll put a link in the description below. When it comes to exercise, make sure you start slow. Always get clearance from your healthcare provider before starting any postpartum exercise routine. Gentle walking is okay within a few days of birth or when you feel comfortable. Short walks can help with circulation and mood. Listen to your body and don't overdo it. If you've had a C-section, then you might need to get advice from your doctor about how and when to start exercising. But in any case, hold off doing any sort of strenuous exercise until about 6 weeks after birth. Movement might be challenging at first, but it's important to gradually increase your activity, as advised by your healthcare provider, to prevent complications like blood clots. Remember, a C-section is major surgery, so be patient with your body as it heals. There are specific gentle core engagement exercises that can help with diastasis recti, but in general, avoid putting strain on your abdominal muscles. Focus on gentle core strengthening exercises instead. Start with basic exercises like diaphragmatic breathing and pelvic tilts. As you progress, you can try more targeted exercises, but it's crucial to avoid movements that put excessive strain on your abs, like traditional crunches or planks, until you've healed. If you're unsure about the extent of your diastasis or how to safely exercise, consider seeing a physiotherapist who specialises in postpartum recovery. Pelvic floor health is another crucial aspect of postpartum recovery. Kegel exercises can help strengthen these muscles, which can prevent issues like urinary incontinence. If you're having trouble with these exercises or experiencing persistent pelvic pain, consider seeing a pelvic floor physiotherapist. If you had a vaginal birth, use a peri bottle with warm water to clean yourself after using the bathroom. Pat dry gently rather than wiping. Ice packs or cold packs can help reduce swelling and discomfort. You can also try sitz baths. Sitting in a few inches of warm water for 10 to 15 minutes several times a day can soothe sore perineal areas and promote healing. Over-the-counter pain relievers like ibuprofen and paracetamol, also known as acetaminophen in the US, can help with discomfort. Always check with your healthcare provider about which medications are safe, especially if you're breastfeeding. If your healthcare provider approves, gentle postpartum massage can help with relaxation and may alleviate some aches and pains. Don't be afraid to accept offers of help from family and friends. Whether it's preparing meals, doing laundry, or watching the baby while you nap, every bit helps. Your emotional well-being is just as important as your physical recovery. Take time for activities that relax you, whether it's reading, listening to music, or talking to friends. Remember, recovery is not a race. It's okay to take things slow and prioritize your healing. Every woman's postpartum journey is unique, so don't compare yourself to others. While many postpartum changes are normal, there are times when you should contact your healthcare provider. It's always better to err on the side of caution if you're unsure. Here are some signs that warrant immediate medical attention. Heavy bleeding. If you're soaking through more than 1 pad an hour or passing large clots bigger than a golf ball, contact your doctor immediately. Signs of infection. Watch out for fever over 100.4 degrees Fahrenheit, which is 38 degrees Celsius. Chills, severe pain, or foul-smelling discharge. This could indicate an infection or retained products, which needs prompt treatment. Severe headache or changes in vision. These could be signs of postpartum preeclampsia, a serious condition that can occur up to 6 weeks after delivery. Chest pain or difficulty breathing. These symptoms could indicate a pulmonary embolism, which is a rare but serious complication. As a former paramedic, I have attended a few postpartum women presenting with PE symptoms, and they did need urgent treatment. Severe pain in your lower leg. This could be a sign of deep vein thrombosis, otherwise known as DVTs, another rare but serious complication. Thoughts of harming yourself or your baby. If you're experiencing these thoughts, seek help immediately. This could be a sign of postpartum depression or anxiety. Incision problems. For those who've had a C-section, watch for signs of infection at the incision site, such as redness, swelling, or discharge. Breast issues. If you develop a hard, red, painful area on your breast, especially if accompanied by fever, contact your healthcare provider, as this could be mastitis. Persistent or worsening pain. While some discomfort is normal, pain that's severe or getting worse instead of better should be evaluated. Urinary problems. If you're having difficulty urinating, experiencing burning sensations, or unable to control your bladder, these issues should be addressed promptly. Remember, you know your body best. If something doesn't feel right, don't hesitate to reach out to your healthcare provider. It's their job to support you through this recovery period, and no concern is too small. In the next episode of this fourth trimester series, I'll be shifting gears to talk about emotional well-being and managing baby blues. Make sure you subscribe to my channel so you know when this one drops. The physical and emotional aspects of postpartum recovery are closely intertwined, so I'll explore how to take care of your mental health during this transformative time.